Hello, my name is Dr. Dewan S. Raja. Today I will discuss about jet lag. What is jet lag? Jet lag is a very common sleep disorder that occurs when a person travels over one or more time zones. It is caused by a disruption of the normal circadian rhythm, sleep-wake cycle, or our internal clock. Usually it lasts a few days to a week. If a person passes multiple time zones very quickly, then it may last up to a week. Okay, so the more time zones a person crosses rapidly, the more jet lag symptoms happen, and those symptoms may continue up to a week. Otherwise, it may last only 1 week if just a person passes over one time zone. This is the rule of thumb usually. This happens, but it varies from person to person. Symptoms of jet lag: insomnia, person cannot sleep properly; fatigue, person has no energy; daytime sleepiness, untimely sleepiness because the time zone is different. When there is day in India, in the United States, it is night. So the person who came from India, his internal clock was adjusted according to the time of India. Now he is in the United States. He came here by 1 or 2 days flight. Okay. Then he has to adjust the new clock. His biological clock should be adjusted. So there will be daytime sleepiness initial few days to maybe a few weeks sometimes, irritability and mood swings because this sleep-wake cycle is maintained by the hypothalamus. Hypothalamus is very essential for the mood and the emotion and also sleep, certainly appetite, renal function, cardiac function, sympathetic and parasympathetic function. So there will be irritability and mood swings, headache that may be also possible, malaise, gastrointestinal disturbances, maybe diarrhea, maybe constipation. So these are the usual symptoms of jet lag. So anyone passing over time zone in a short time, usually by a jet, okay, and that person may have symptoms of jet lag. Okay, if you look at the textbook of physiology, Guyton and Hall, we are saying this is the hypothalamus. It is very important nucleus, suprachiasmatic nucleus, that is getting input from the natural light, day night, from the eye, from the retina to the hypothalamus. That also controls, hypothalamus also controls by releasing factor to the endocrine organs. Hypothalamus controls autonomic nervous system, sympathetic, parasympathetic core body temperature. It also controls the appetite, hunger and satiety, okay, feeding behavior. It maintains sleep-wake cycle, cognition and mood. So small hypothalamus has many action. Also here is social and familial cues here. So these all are the functions of the circadian rhythm, and the main nucleus is suprachiasmatic nucleus of the hypothalamus that will control the renal blood flow, control the cardiovascular function like heart rate, liver metabolism, stomach motility plus the starting of digestion of food. So everything controlled by the hypothalamus directly or indirectly. So this hypothalamus need to adjust a new sleep-wake cycle, new internal clock, okay, or maintain the circadian rhythm in a new environment. It takes time, okay. Okay, how to decrease symptoms of jet lag? Preparation for a flight where from India to Japan, then the person should go to the bed a few hours earlier, or India to United Kingdom or United States or Canada, then person may be late to go to the bed to sleep. Okay, so that may not be always possible, but this is an idea like that. Hydration during the flight, a lot of fluid, most likely the plain water as well as the fruit juice. Exposure to natural light if possible, as much as possible. Avoiding alcohol or caffeine. Short nap. It may be frequent short nap, maybe multiple short naps. Shower to refresh. Light meal, not heavy meal. Exercise, it indicate walking, maybe in the transition, maybe on the destination, after destination there may be walking. And loose attire, so all the clothing should be loose so that person can relax nicely. Adjust to clock hour. Clock hour need to be adjusted because the clock hour in India or Malaysia or Singapore is different from that of the United States. So once a person came to the new time zone, new area, he or she should change the clock hour. Okay. Adjust to time to clock hour, sleep and meal time in the new time zone. Medication like melatonin, this is a hormonal substance. It also released from our brain to a certain extent with the pineal gland. Okay, so melatonin is also found as a preparation in the pharmacy, even it can be purchased without prescription in the United States. But this is an anxiolytic relaxing drug, benzodiazepine. It should come from the prescription of a registered physician. Okay, so before taking medication, dosage is also important, and the medication, and we need to consult with a physician. And that's all about the jet lag. Jet lag, there is no cure, but we may decrease the symptom with some preparation and some precaution. There is no perfect medication for jet lag, but we may use melatonin. Even we may use some type of benzodiazepine like Sidaxine, Valium. That may work, but it should come from a physician consultation to maintain the dose. And during the flight, it is better to avoid alcohol and too much caffeine. Okay, that's all about the jet lag. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.